To order the Health, Education, and Welfare Committee meeting. Today is July the 13th, 2022. The time is 2 o'clock, and I will ask Representative Leonard Gouge for our invocation. Please stand if you're able.
We should have a part of things together today as a tribe of business. Take care of the people that tribe. I don't forgive me today. I don't forgive me together in civil matters. That's for the people overall.
No, Representative Gouge. Roll call vote. Legislative Clerk April Lindsay.
Mary Crawford.
Present.
Joyce Steer.
Present.
Leonard Gouge.
Here.
Robert Hufft.
Present.
Anna Marshall.
Present.
Madam Chair, you got 5 present and 0 absent.
Five present and 0 absent constitutes quorum. All business will be considered official. The first order of business is of June the 8th, 2022. I will entertain a motion when the committee is ready.
Madam Chair,
Yes, Representative Marshall.
I make a motion that we approve the minutes of June the 8th, 2022 with any necessary changes.
We have a motion on the floor from Representative Marshall.
Second.
Second by Representative Crawford. Roll call vote, please.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Robert Hufft.
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. The approval, the minutes of June the 8th, 2022 are approved. First order of business, TR 22-110, a tribal resolution of the Muskogee Creek Nation authorizing the election board to execute an attorney contract between the Muskogee Creek Nation Election Board and CCAT Law Firm. Sponsor Anna Marshall.
Madam Chair, I make a motion to move that to the bottom of the agenda.
Representative Marshall has made a motion to move TR 22-110 to the bottom of the agenda, the last item for today. Second by Representative Crawford. Roll call vote, please.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Robert Hufft.
Yes.
Mary Crawford. Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. TR 22-110 will be moved to the final item on the agenda. TR 22-111, a tribal resolution of the Muskogee Creek Nation confirming the nomination of Sarah Barnett afraid to say your last name to serve on the Muskogee Creek Nation Election Board. Sponsor Robert Hufft.
Motion to pass.
Representative Hufft have made a motion to do pass. Is there a second?
Second.
Second by Representative Gouge. Roll call vote, please.
Madam Chair,
Sorry.
Representative Hufft here. Ms. Barnett is in the audience, I believe.
Would you like to come forward and introduce yourself, please? And explain to me how you say your last name? I didn't want to miss.
Yes, it's on. Hishjay Stongo, Sarah Barnett, Jahojif Kados. My married name is Insaka Shalo. I want to thank everyone for the support and the nomination for me to serve on the election board. I have worked the election for several years now, the last 3 elections, helping count the absentee ballots. I really enjoyed the ability to serve the tribe in that capacity and hope that I'll be able to continue to serve and look forward to serving with the other election board members. Happy to answer any questions.
Are there any questions from the committee for Ms. Nakashalo? Hearing none, are there any questions from council online or in attendance?
Yes, Chair. This is Representative Harjo.
And I just want to make a comment. It was a pleasure meeting Sarah during the festival, and I got to sit and just visit with her for a moment. And I believe it was her aunt. And so again, I'm excited to see her come on and be a part of this board. Thank you.
Representative Harjo. Are there any other questions or comments? Hearing none, roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. TR 22-111 has passed this committee. Ms. Barnett, Akashalo, you go by both names?
Usually I just go by Barnett. Professionally, legal name is Barnett and Sakashalo. Yes.
Okay, can I ask you to be here for the full council on July the 30th at 9 a.m. for pre-agenda that you can introduce yourself to the full council.
Yes.
Thank you
Mado.
very much. Next item is TR 22-113, a tribal resolution of the Muskogee Creek Nation authorizing the Department of Community and Human Services to participate in a nationwide elder needs assessment in order to apply for a Title VI grant to fund the nation's elderly nutrition program. Sponsor Robert Hufft.
Motion do pass.
We have a motion from Representative Hufft for do pass. Is there a second?
Second.
Second by Representative Gao. Discussion.
Madam Chair, Miranda Carmen's in the audience.
Ms. Carmen.
Good afternoon, committee. I do have our representative here from Elderly Nutrition to answer any questions that you all may have. This piece of legislation is to authorize us to do the survey that's required for the funding. And so this will be a pre-requirement for us submitting for the continuation of funding that we receive for the Elderly Nutrition Program.
Are there any questions from the committee?
Madam Chair, I have a question.
Yes.
You're
Marshall.
doing this survey, and so what's the timeline on the survey? Is it going to be going out to all the, is it going to be the participants in the nutrition center that will be answering the questions, or is it going out to all the elders, or how are you going to do this?
And Anna should be here. They normally, the assessments go out, they come to us, we send them out to our elderly nutrition centers, and then yes, they will fill them out there. Our employees usually help them fill them out, things like that. Once we get all of those in, the application for the Title VI funding starts in September. So once we get all these in, then we can apply for our FY23 funding. So the timeline to get it done is approaching.
Yes. Okay. Thank you.
Representative Marshall, are there other questions? Are there questions from council in attendance or online?
Madam Chair, Will Lowe.
Yes, Representative Lowe, Speaker Lowe, I'm sorry.
Yes, ma'am. Secretary Carmen, is there any way the council could get the survey results when you all are finished so we can preview them as well?
Absolutely. Yes, we can provide that.
Okay. Madam Chair.
Thank you, sir. Any other questions? Hearing none, roll call vote, please.
Robert Huff,
Yes.
Mary Crawford,
Yes.
Anna Marshall,
Yes.
Leonard Gouch.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. TR 22-113 is passed.
No, thank you.
NCA 22-081, a law of the Muskogee Creek Nation authorizing a budget modification to transfer funds from the skilled nursing facility to the long-term acute care hospital to the Muskogee Creek Nation Medical Center FY 22 budget on behalf of the Muskogee Creek Nation Department of Health. Sponsor Anna Marshall.
Motion for due pass.
The motion from Representative Marshall for due pass. Is there a second?
Second.
Second from Representative Crawford. Discussion. Mr. Terry will answer questions.
Thank you,
Yes.
Madam Chair. Thank you, committee. As I mentioned last month, we had moved the long-term acute care hospital and the skilled nursing unit from the rehabilitation hospital over to the medical center. So this budget is really just, all you're doing is physically moving it from one accounting number over to another accounting number. The numbers aren't changing. We're not adding money. There's nothing changing in the line items for anything. It's just taking it out of the rehabilitation hospital, moving it to the medical center. And I'm happy to answer any questions.
Are there any questions from the committee for Mr. Terry, please?
Thank you.
Any questions from council in attendance or online? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 22-081 is passed. PR 22-110, a tribal resolution of the Muskogee Creek Nation authorizing the election board to execute an attorney contract between the Muskogee Creek Nation Election Board and CCAT Law Firm. Sponsor Anna Marshall.
I make a motion to go into executive session.
Representative Marshall has made a motion to go into executive session. Is there a second?
Second.
Seconded by Representative Crawford. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Okay, we're back out of executive session.
Madam Chair,
Representative Marshall.
I would like to make a motion for the TR 22-110 that we postponed it for 30 days and give the election board an opportunity to work with CCAT Law Firm and to come back with another contract. And it would also give the opportunity for the Attorney General to be able to review it and so that we'll be able to move forward.
Thank you, Representative Marshall. We have a motion on the floor. Is there a second?
Second.
Second by Representative Gouge. Roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 22-081 is postponed for 30 days. I'm sorry, TR 22-110 is postponed for 30 days. We are down to other business. The discussion is the health systems update with Secretary of Health, Sean Terry.
Thank you, Madam Chair. Good afternoon, committee. I will like to give the report for June of this year. And before we get started, I'd like to say just maybe a few words about what the current status of COVID is throughout the nation. This week, the newest variant of COVID has hit about 23% positivity inside the nation. We did about 350 tests this week, with a quarter of them being positive. The vast majority of these cases are symptoms of sore throat, headache, mild to moderate fatigue. The hospitalizations haven't been significantly higher. The number of deaths are almost non-existent. So this thing is, from what we've seen, is not the killer that the previous variants were, and but the cases are very, very high. Some of the literature that we're reading right now is stating that this variant is a little resistant to the vaccination. And so even if you are vaccinated, you could still catch this variant. However, there's also literature that says that being fully vaccinated may reduce the intensity of the virus. So you may not get as sick if you keep that. There's two predominant drugs that we're using to fight this variant. One of them is a monoclonal antibody that you know that we've been doing these infusions since for a long time now, and this infusion is very, very short. We can do it just within a few minutes. We do have to watch you for about an hour afterwards. And then there's also a drug called Paxlovid, which is a prescription pill that we can give you if you're positive. And that is the first line treatment. The infusion is a second line treatment. From what I've witnessed is that the patients on Paxlovid usually end up with a very metallic, awful taste in their mouth with this drug. And so I think that you have a lot of folks saying they would rather just have a sore throat than have to taste that medication. But the Paxlovid and the monoclonal antibody infusion are the two treatments. But the vast majority of people, the chief complaint with this variant has been sore throat, headache, fatigue. And you can usually get by, a lot of folks are just getting by with ibuprofen and Hall's cough drops and over-the-counter medications. So that's sort of what the status of COVID is today. But it is increasing, it is on the rise, and there's a lot of it out there. And we're trying to assess what that's going to be doing to our workforce. We have a lot of employees right now that are positive. But fortunately today, one of the aspects of the previous strains were that if someone in your house had COVID, then you would have to be quarantined. But that's no longer the case. So we don't quarantine people that are just exposed. Now you have to either be positive or you're not positive. And that's typically how this is going. So we still have folks that say, well, my husband tested positive. Do I need to stay home or do I need to go home? And that answer is that's not the recommendations any longer, that you just have to only remain home if you're positive. And then if you do have exposure, then we require you to wear a mask for 10 days. So that's sort of what the state of COVID is. And if you guys have any questions about COVID before I move on, I'm happy to answer.
Secretary Terry, I have one. Is there a time frame, like say if you tested and you were positive and then you have to wait to be tested again, or should you be tested again, or what's the rule?
So here's the problem with that, Ms. Deere, is that what the science is saying is that by the time you feel your symptoms, you were probably positive 2 days before that. and you were infectious 2 days before that. And so typically by the time you start to have symptoms, those symptoms are going to start decreasing in about 2 or 3 days. And there's a good chance that you could test negative in just 2 or 3 days. But you remember in the first 2 strains, we would say you needed 14 days to go to that. So we see people testing negative very quickly after this. And the reason is that you were already positive several days before you ever even started feeling symptoms. And you were the most infectious several days before you started feeling. So it's such a frustrating virus. Our governing board this morning voted that we're now taking this off of pandemic status and just putting this into a chronic disease status inside of the Department of Health. This thing is mutating quicker than we can develop new vaccinations for it. There is a new vaccination that is on the market that's coming out that's not an mRNA vaccine. It's the old style vaccine where they took the dead virus and created it like they do the flu vaccine. That vaccine has been set for approval and should be coming out very soon. But what I would say, Ms. Deere, is as soon as your symptoms is gone, within 24 hours, I would probably take a test and just be done after that. I don't think that, and if you're not sure, they use 5 days as kind of the general stay at home for 5 days.
The reason why I asked that, I had an employee ask me, they said they had asked their supervisor, can I be tested again? And they said, no, it's too soon. You've already been tested. So I don't know when they were tested, what the time frame was, but that's what they were told.
Well, the problem is there's a lot of what ifs. What if this? When was your first symptoms? When were you first find out? What are you doing? What are you doing? So it's hard to answer those hypotheticals because there's so many what ifs. And employee health, when they talk to employee health, they go through a whole checklist of these what if this, what if that. So I'm happy to dig down into the what ifs of that particular one, but there's not just if they say, I started feeling symptoms 2 days ago, then that means you probably started being positive 4 days ago. So now you need to probably be off 1 day. But if you started feeling bad today, then you were tested positive 2 days ago, right? So it's just all those scenarios are different, and it's hard to put it into one answer fits all.
Thank you.
I know it's confusing. I'm sorry about that. It's confusing to us too.
Well, I guess my question was, does someone tell you you can't get tested or you shouldn't get tested, or is it just up to me? If I decide I need,
I would
think
just
I
take,
want to get
I would
tested.
just take the test, you know, and what I would say is if they've recovered, come back, take a test and do what they want to do. I think it's going to be like it was with the flu. Once you didn't feel sick anymore, come back to work.
Mhm.
I think that's where we're at with this.
Thank you.
Ms. Crawford has Epic over at Council Oak this afternoon with the financial team. So I'm going to go through the financials today as well through the report. We already talked about COVID in its current state, but it was 21% across the jurisdiction last month. The vaccines administered through the month of June, the Department of Health has done 49,458 vaccines, including 14 Pfizer doses for the ages 5 to 11. And the vaccine events continue to be provided as requested at all of our locations. One of the problems with the vaccine, and I've mentioned this to you guys in the past, maybe not with the newer council members on board, but the vaccine doses come in doses of 10 doses per vial. And so it's really hard to have a patient come in and say, I want a vaccine today. And if we open that vial up, we got to find 10 other folks to try to give that, or we're throwing away doses. So typically we have like a Wednesday afternoon, and we try to get all of our booster shots on that day so that we're not wasting as much vaccine. But we are doing vaccinations everywhere. Our public health activities through June, we started our sports camps. And we had a few hiccups with the weather to get them kicked off the ground, but I think all of those have now been successful, and they're over. And I know that they had some very good participation out there with the sports camps. We are in the process of developing a phase of initiating a comprehensive diabetes program, which includes a Native American Diabetes Association dietary program and a specialty clinic established to manage our highest risk diabetics with an internist, a general practitioner that conducts these exams with a endocrinologist, a specialist, and a specialist who specializes in the endocrine system, which includes diabetes and thyroid. We're in discussion with this doctor, and we're hoping that she joins us in the next few months. We pulled the list, I think I may have mentioned in the past, we pulled the list of about 1,700 patients that had hemoglobin A1Cs over 9 that was in our system. And so we're going to go full force at these 1,700 patients with the goal of trying to drive that A1C back down up under 9. And we know that these are the highest risk folks in our system. So we're getting ready to go make a full everything we got on those highest risk diabetics. From the, we have, and we're creating a comprehensive maternal fetal prenatal infant program to address the maternal fetal gaps that are in the nation. As many of you know, the mortality rate for Creek babies is twice as high as the non-native population inside of our 11 counties. So we've been working with the University of Oklahoma, and we're now doing frontline prenatal work at Mulgee and Okemah. We're going to do that at Council Oak as well. And as I've said many times, if we can't get our babies alive, our tribe's going to die, and that's the future of our nation. So we're going to also throw a lot of resources this year into trying to improve that infant mortality rate as well. From a facility standpoint, the Council Oak is moving along nicely. We're going to start taking patients inpatient here in a couple weeks. We have to complete 6 patients, I believe, before Medicare will give us a license. And that'll take about 30 days for us to see those patients and discharge them. And once we do that, just so you know, we are financially on the hook for those patients until Medicare gives us a license. So we'll be doing that with the goal. That'll be through the month of August. That should have us opening the inpatient wing of Council Oak at somewhere in September. So we're excited. We're getting really close to opening that up, and that's all going well. Right now, the biggest issues that we have out there is still staffing, and we still have that same post-pandemic staffing issue where there's a shortage of nurses and x-ray techs and lab people and everything else. So we're continuing to hunt for people, but it's getting better, and staff is getting on board. We sat and had a meeting last week at at Sapulpa to meet with a developer about trying to find a land to finally develop a new Sapulpa clinic. We've decided that we now can fund the new Sapulpa clinic with the 105L lease program through Indian Health Service. And so we think it's time that our nation just goes ahead and bites the bullet, let the Department of Health take the loan out, and we can pay that loan back through the 105L lease from the federal government. We're in about 4 different buildings in Sapulpa. They're all over the place. We're leasing all of these buildings. It's expensive. They're all crummy buildings, and we want to do that. And then also we've been exploring about doing the same thing, that if the council votes to let us take our shares out of Wewoka, that we would also build some sort of new facility in Holdenville as well to start that facility down there. So that's what that looks like. We had, from a third-party collection standpoint, we did $16 million last month. That was by and far the largest month that we've ever had. And all of the graphs have been sent to April for you guys to have electronically. So you guys can look at all of those when you need to. Jumping into the financials, all of our clinics are running in the black. That may be the first time that we've ever had all of our clinics in the black, so that's fantastic. If you guys will remember last year, Altmogi Clinic was really the only clinic that was operating in the black, and everybody else would be just a little bit in the red, but everybody's in the black. We've done year to date in third-party collections, we've done $116 million this year already, as opposed to this time last year, we were at $68 million. So that's a $48 million increase over where we were at last year, and everything's going well. The only place that we're going to probably be losing some money at this year is at Council Oak, being a new facility and trying to hire all these people and getting this place up and going. But we took that into consideration through our budget year, and we know we got about another year to get that place profitable. But by and large, our budget's very strong, and the finances are very strong, and the Department of Health continues to do some good things. So, Madam Chair, that's my report for the month, and I'm happy to take questions.
Thank you, Secretary Terry. Are there any questions for Mr. Terry?
Madam Chair, I have a question.
Yes, Representative Gouge.
Have you figured out the issue with Okima and the non-native, I guess, coming into the clinics down there? City of Okima?
So I know that that's been kicked to the attorneys, and they're starting to draft some opinions on that.
Okay, good. And the other question is, which I don't have a clue where you're at on it, but did the blood bank ever get started at the Council Oaks?
I know that I signed for the machine, which was a whole lot of money, but I can't tell you if it's there. But I'll find out that question and I'll send that report to you.
Okay.
I know that it's been ordered, but I don't know the answer.
All right, thank you.
Any other questions? I have a question.
Hey, Jeff, this is Leah. Madam Chair, this is Thomasene. Jeff,
Okay.
just wanted me to let you know she's on the call right now. Is that for me, Madam Chair?
Yes, go ahead. You have the
Okay.
floor.
Mr. Terry, you'd mentioned earlier about the Wewoka Indian Health and possibly opening up a clinic in Holdenville. Is that going to affect the Wetumpka Clinic in any way?
So thank you, Ms. Osborne, for that information, or for that question. So we contacted Admiral Watts at Indian Health Service, and we specifically asked him, would this negatively affect the clinic? And he assured us that it would not affect them at all. And so there would be no layoffs, there would be no reductions in the Okemah operating budget. That the only thing this is really going to affect is that the Creek citizens, that right now their contract health has to go to EWOCA for approval. We're going to now be able to approve all of those contract health funds in our own system, and they won't have to wait for that referral. So with taking Admiral Watts at his word, Ms. Osborne, that there shouldn't be any negative impact to EWOCA.
Okay, so my question was the Wetumpka Clinic.
Oh, I'm sorry, Wetumpka. No, ma'am. I am so sorry. No, Wetumpka is as you know, a nurse practitioner clinic. We think that probably getting started, Holdenville could be a nurse practitioner clinic. I did speak to a Creek citizen this week that's a family medicine doctor that lives down that direction, that we are talking to, trying to expand maybe to a physician level provider at Wetumpka. But right now, financially, Wetumpka keeps its head above water. I think that all of the clinics are, these nurse practitioner clinics in these small towns. I wish we had more of them for kind of urgent care type of setting. So it won't negatively affect it at all.
Thank you. Thank you, Chair.
Thank you, Representative Osborne. Are there any other questions for Mr. Terry? I have one. Are the hours of operation of most of the clinics the same?
I'm sorry.
The hours of operation of most of the clinics, are they the same?
So right now, all of the clinics, the main clinics are 8 to 5. A few of the clinics have administrative days where the doctors are all maybe on Wednesday afternoons at Coweta, but they may be on a different day at Sapulpa or a different day at Okmulgee. So not everyone's consistent. Different doctors have different administrative times. They get 4 hours a week for charting in those admin times. So that depends. Now, Council Oak, we've got the urgent care that's open 7 a.m. to 7 p.m. So we always have the Council Oak urgent care that is there, and it's open 9 to 5 on the weekends. And so that's the main clinic difference that we have. But everything else is typically 8 to 5, but some do things different at lunch and their admin times.
What about holidays?
The holidays is pretty much everybody's all the same. So what happens during the holidays, and here's what we've been trying to address, is a lot of time the tribe will close early the day before a holiday. Well, oftentimes what we do when the tribe makes an announcement that they're going to close early, then we call the administrators and we assess how many patients are booked on that afternoon. If we have patients that are booked all of that afternoon, typically the clinics don't want to cancel all of those patients for the holiday. So they choose whether or not they're going to close or not close. So one of the things that the administrators ask us to do going forward is that they want us to do a early closing calendar for the year so that they can book that out and there won't be any confusion. But by and large, if we stay open, if one clinic stays open, all the clinics are going to stay open before the day before a holiday. But on holidays, everybody closes. Once again, except for Council Oak, except for the hospitals. And Council Oak, if like a holiday is on a Monday, Council Oak will stay open on Saturday and Sunday, but be closed on Monday. Does that make sense?
Well, I guess because it's a health facility, did they close early on the 4th of July? Because the citizen contacted me and said they had seen a flyer and they said, is this a hospital or what? You know, like citizens don't matter if it's a holiday. There's not going to be any health issues or anything come up. So that was their concern.
We were open on the 2nd. We didn't close early for the 4th of July. We were open on Saturday and Sunday. We closed the urgent care on the 4th, but the emergency room's open. So we still have the 2 hospitals up and going and the ERs. So just the clinics were, yeah.
Thank you.
Thank you.
Are there any other questions?
I have a question.
Yes, Representative Harjo, go ahead.
Yes, I was just wondering, you know, and not related to all the stuff that's just been previously talked about, but you know, when I hear about Council Oak and I hear about a lot of different special things that they have to offer, now, are there going to be any of those things that are going to be able to be transferred down to like the Okemah Clinic or Okemah Hospital and the Okmulgee Clinic and the Okmulgee Hospital? So that way, because I know that some of our clients that we have south here, they can't really afford to always make, you know, long trips to Tulsa. And I have some other questions. And the other question is, you know, you were speaking in terms about, you know, making sure our kids are going to be okay. And that's all, that's good and everything. But with these hospitals in place, you know, at one time we used to be able to deliver our own kids here in our hospitals, and Okmulgee used to do that. Okemah used to do that. And I'm just wondering if we're ever going to get back to the point of having that ability to do so. And my last question is, you know, with, you know, Okemah being a new facility, and of course, Okmulgee's been in place for a long time. I'm just wondering when, if we're ever going to have a place to where we can deal with some, and I know we're not going to be able to deal with every ICU issue, because there may be some that that are more severe that need to go to Tulsa or somewhere. But I'm just wondering if we'll ever have the ability to do an ICU unit up to, you know, a point. I guess I could say like that. Thank you.
Yeah. Thank you. So that's a really long answer, but I'm going to try to do the best I can. So with specialty care, today we do a cardiology clinic with Oklahoma Heart Institute in Okemah 1 day a week. We do a urology clinic with Utica Park Clinic in Okmulgee every other Thursday. We have a pain management clinic in Okmulgee that we do. We have a general surgery clinic in Okmulgee, and we are doing a prenatal clinic in Okemah with the University of Oklahoma Health Science Center, and we're doing a prenatal clinic with the University of Oklahoma in Okmulgee. And all of these specialties are specialties that we're also building at Council Oak and in Tulsa. So every one of these services that we do assess whether we have the ability to go do a clinic in Okemah and a clinic in Okmulgee as well. So the short answer is yes, we are doing that. We're going to continue to do that. The issue regarding babies, if you look across Oklahoma, the vast majority of rural hospitals today don't deliver babies. There's a lot of reasons for that. Most of it is the fact that delivering babies is so litigious in this world that a lot of OB doctors have stopped doing deliveries, and they usually congregate into groups into Tulsa at the big facilities. So if you look at outside of Tulsa, there's not just a whole lot of hospitals doing deliveries these days. Now, we have been talking with the University of Oklahoma about doing deliveries inside of the patient rooms. So there wouldn't be a quote nursery at the hospital, but they do have situations where they do deliveries inside the room. And we are talking with Dr. Gold about that. But on the other hand, we're also focused on a lot of our high-risk pregnancies, which a lot of these high-risk pregnancies need to go to Tulsa for that care. And that's why the University of Oklahoma has been such a good partner. It's a great goal for us, I think, to potentially be able to build that OB delivery program. It's not a quick fix. It's not something simple. We are talking about it, but it would be a major investment in the tribe to do that. And all of that really is, do you have enough labor and delivery doctors that can cover the hospital 24/7? Can you keep one of your operating rooms ready for C-section 24/7? Do you have a nursery? What do you do with high-risk baby that's delivered? Can you fly them out and get them to a NICU fast enough? It's just complicated when you start birthing babies. But we will keep that on our list of items, Mr. Harjo, and work towards that. So hopefully that answered your question.
Thank you. Yeah, I appreciate it.
Thank you, Representative Harjo. Are there any other questions for Secretary Terry? Hearing none. Thank you, sir. We appreciate this update.
Thank you, committee. Just off the record, I have a wedding this weekend. I'll be, after 12 years, tying the knot. So I'm going to be off work for about a week. So if you have something that's really urgent, you can always call. You can always still text me. I have my phone when there's those emergencies that you do need me. But Miss Crawford will be in charge next week, or Rhonda will be around there. But I will be away from the office, and so we're excited about this. It's been a long time since our girls were. Since they've been little, we've waited for them to get out of high school. And so that's the next chapter of my life. And so I just wanted to let you guys know that.
Thank you. Congratulations.
Thank you.
All right, we are down to announcements. Do we have any announcements from the committee? No? Okay, we are down to our adjournment and benediction. I would ask Representative Anna Marshall if she would do our benediction, which will serve as our adjournment.
Creator God, we just thank you for this opportunity of just leading and guiding us today. And we just continue to trust in all the things that you lead us to do. And we just ask that you just give us traveling mercies as we leave this place, and that you just bless and protect us each and every day. We just ask all these things in your name. Amen.
Amen. Thank you, committee. We are adjourned at 3:21 p.m.
Gosh, it's really